عليكم ورحمة الله وبركاته. Now we will discuss theoretical assessment. It will be illustrated, inshallah, with me, Dr. Ayman Lashar, FEMAR Fellow 2020, and Head of Medical Education Training Unit at University of Bisha College of Medicine. First of all, we should know the criteria to evaluate various question types. We have 5 criteria to evaluate the advantages and disadvantages of various question types and your exam. Number 1, reliability, or in other words, repeatability. Number 2, validity, which means the question measure what is intended to measure. Number 3, educational impact. Number 4, cost effectiveness. Number 5, acceptability. Let's start with the first one, reliability. That's to say the accuracy with which a score on a test is determined. Again, regarding reliability, if your test is reliable, it means that the student will obtain the same score if equally difficult test in the same course, which that's to say parallel test. If your test is reliable, it means that exam can discriminate between students who mastered the course and who did not, which is important. We have an important measure for the reliability, which is the KR20 or Cronbach alpha. Let's go to number 2, validity, which refer to whether the question actually test what it is intended to test. It is important to collect evidence to ensure validity. An analysis of distribution of course topics within test elements, a so-called blueprint. So, a rapid conclusion, to be sure that the test is reliable, you can measure the KR20 or Cronbach alpha factor. Validity, you should have blueprint for your course in order to be sure that there is good distribution of questions across the topics of the course. This is a blueprint, summarize the blueprint. For example, you should write the theme, type of activity, which is lecture, title, objectives, for example, and questions, and discriminate these questions. Will they be MCQs or short answer? Will they test knowledge, understanding, analysis, application, or psychomotor? So this diagram can make it easy to understand what is the difference between reliability and validity. For this, it is reliable, that's to say repeatable, beside each other, but away from the target, not valid. This shape, low validity and low reliability, not beside each other and away from the target. This not reliable, not valid, but this both reliable and to the target, valid. Number 3, educational impact. It is very important why students tend to focus strongly on what they believe will be in the examination. Students will prepare strategically, depend on the question types used according to the SLOs. Let's see this. This is a summarized study guide containing activity title, type of the activity, and specific learning outcomes. So the students will know how to identify patient safety risk. They should masterize to how to explain principles of the management of adverse events and near miss and so on. So the exam should be aligned with the specific learning outcomes. Then number 4, cost effectiveness. Cost effectiveness means time needed for question construction, the student to answer, and correction for the question. It should be acceptable time, no very long time. If extra machines are needed, if the question need machines, did your SLOs are covered well? So this is the cost effectiveness, time needed for the faculty member to create a question should be acceptable. Time needed for the student to answer the question should be acceptable, and correction of question don't need much more time to avoid exhaustion of the faculty members. Then the last item is acceptability. The best designed examination will not survive if it is not accepted by teachers and students. Different types of assessment questions. Number 1, essay questions. Number 2, modified essay questions. Short essay questions. Short answer questions. It may be short answer, open-ended questions. Multiple choice questions, MCQs. It may be multiple true-false format or single best answer format. Extended matching questions. And script concordance test. Essay questions, advantages. It assesses the ability of a student to summarize, hypothesize, scientific writing, and process information, but it have disadvantages like time consuming, difficult to avoid subjectivity in scoring. MEQs, family medicine general practice MEQ exam. This is an example. You can have a scenario, then you can see your complete physical exam, including CNS entirely normal. Name 5 key pieces of info you need to collect from patient history that might help in reaching clear definition of clinical problem here. Okay, then what 4 approaches to management? Multiple essay questions. If you decide meds might help her, name 4 classes of drugs available to treat her. For example, choose 1 med or medication and name 3 SES. This is the type of multiple essay questions. You ask about, for example, 4 approaches for management, 5 key pieces of information you needed, and so on. This is multiple essay questions. It is a sequence of questions based on patient scenario that develop over a period of time. So as a start, they asked you about the history, 5 clues in the history. then how to diagnose, then drugs, and so on. After the first question is answered, further information is provided about the patient, and this is followed by another question. The typical MEQ may have 6 or more questions, and both short answer question and MCQs may be used in this MEQs. So, to summarize, you should have a patient scenario, then give successive questions in order and ask the student to answer these successive questions. You can use short answer question and MCQs in this series of questions. Disadvantage of MEQs, difficulties in the preparation of questions, need experts to develop these questions, but they are used in CBL, case-based learning. Short essay questions, it is essential to define criteria on which the answers will be judged. It is important to describe clearly how detailed the answers should be. Advantage of these questions: sample a wider range of content than the essay questions, because it needs enumeration, it needs listing, and so on. But disadvantage as essay questions. You can't eliminate subjectivity in correction of these questions, and also time consuming. Short answer question, it is an open-ended question. It is important to describe clearly how detailed the answer should be. Agreement must be reached regarding acceptable answer. Regarding short answer, for example, define so and so. You can mention so and so and so on. This is short answer question. Advantage, it is more flexible. It gives flexibility for students to express himself. But disadvantage, it's time consuming and expensive to produce and to score, may make faculty members to be exhausted during scoring. Multiple choice question in the form of true, false. You have a statement, then 2 brackets, true or false. Sometimes, in some exams, you may be asked to correct the answer, some items in the false statements. Advantage of this type of MCQ, it is concise, answered very quickly, and can cover a broad domain. But disadvantage with false option is correct. Does the student know the correct fact? Sometimes if a student tick false, does the student know the correct or not? So in some exams, the student is asked, if you choose false, please tell us the correct answer. MCQ, single best answer. A statement or scenario, then 4 or 3 choices, and choose one. Single best answer. Advantages, it is a well-known method, has high reliability per hour of testing, answer quickly, can cover broad domain in a short space of time, and it is easier to construct by the faculty. A useful guide to the construction can be found on the website of the National Board of Medical Examiners. We have extended multiple questions. For example, option list, Treponema pallidum, rubella virus, human papilloma, human herpes virus. You have a list of answers, then 4 or 3 statements. You should choose the suitable answer from the long list for these 4 statements. Okay, we have 4 statements, but here I think 10 choices. For each one, you should choose an answer from this list. Advantage of this type of questions: it minimizes the queuing effect that occur in standard MCQs. Test application of knowledge or problem-solving ability, and easier to construct. Reliability is accepted, but disadvantages: teachers need training and practice to develop this type of questions. Risk of an underrepresentation of certain teams. Script concordance test. It is relatively new form of written assessment. A very brief scenario is presented to the candidate with hypotheses about a diagnosis. The candidate are then asked to indicate the value of certain symptom or finding for diagnosis. For example, we have a scenario here. If a 25-year-old male patient is admitted to the emergency room after a fall from motorcycle with a direct impact to the pubis. Vital signs are normal. The X-ray reveals fracture of the pelvis with a disjunction of pubic symphysis or symphysis pubis. If you are thinking of urethral rupture, and then you find urethral bleeding, this hypothesis can be rated, sorry, -2, -1, 0, +1, +2. Here, you need to know how much do you adopt special hypothesis for diagnosis of this scenario. For example, you think of urethral rupture, for example, and you find perineal hematoma. This hypothesis can be rated circle best response. What's your acceptance of this hypothesis, and so on. Advantage of this type of questions: it is reliable, valid, useful in assessing student clinical reasoning, which is very important in last years of studying medicine, 5th and 6th years. Disadvantages: new and possibly unfamiliar method. It is difficult to construct script concordance test. Require careful selection of specific questions for the cases. And also no prefixed answer key. A panel of experts is needed to provide a reference for the scoring. Now take care. When teachers are forced to use a particular question type, this will tend to ask about the themes that can be easily assessed with that question type, and they will neglect the topics for which the question type is less well suited. So don't force teacher to use specific type of questions. You should leave the door open for innovation. Leave the door open for the personality of the teacher to develop and create the suitable questions for him. So it is wise to vary question types in different exams. Remember, choose the appropriate question to examine the appropriate specific learning outcome. Thank you so much, and hope this summarized lecture highlight different types of exam questions.